Hi, this is our second video regarding what providers for youth experiencing homelessness need to know about COVID-19. This video is about triage. My name is Dr. Coco Auerswald. I'm a physician at the UC Berkeley School of Public Health, co-director of our community action team here at the School of Public Health, and co-director of I4Y. What does triage mean? Triage involves sorting people into groups so that you can address their needs. So in medical terms, triage has to do with how seriously ill people are so that you can get them to the level of care that they need. So now that you've asked people about symptoms, the symptoms we talked about in the screening video that you hopefully just watched, now you want to know what to do with people who have no symptoms. So people who have no symptoms, who didn't have fever, cough, or shortness of breath, and didn't have a fever, need to be instructed on how to stay well and get education about that. So you should tell them to wash their hands often with soap and water for at least 20 seconds, to stay socially distant from each other, to avoid touching their eyes, nose and mouth with unwashed hands. And if they cough or sneeze, they should cover their cough or sneeze with a tissue, then throw the tissue in the trash. If they don't have access to soap and water, of course, they should use hand sanitizer. If someone does have symptoms, so they did say they have fever or cough, maybe they have some mild shortness of breath, but can go ahead with their activities. And so they don't seem particularly sick. They may be as sick as someone might be on another normal day in drop-in or in a shelter, but not so sick that you would normally want to do anything for them in particular. Then for those folks, you want to give them a mask, but you also want to separate them. So you don't want them to be with the folks who have no symptoms. You want them to be someplace else. And that means being either in their own room, which is very difficult to do in drop-in or in shelters, or they need to be in a large, well-ventilated room. And just like the folks with no symptoms, it's important to encourage them to stay as far apart as possible, preferably 6 feet. Again, you probably have to kick in your harm reduction muscles and encourage them to stay as far apart as they can if they can't stay 6 feet apart, and certainly not to touch each other. So folks who are sick but not very sick, again, just as sick as you might be if you went to school or to work normally, but you weren't really that sick in a normal situation, non-COVID-19. But if they have an underlying condition, so one of those conditions we talked about before that affects their immune system, so HIV, diabetes, asthma, pregnancy, those other conditions we talked about, then they need to go to clinic. So if they have any fever, any cough, any shortness of breath, they need to go to clinic. You would give them a mask and send them out. They should not be staying in your shelter or your drop-in. Given their higher risk status, they should go to clinic, they should get evaluated, and hopefully the county is setting aside places for these high-risk folks to take care of themselves in a safe way and be monitored. The next group are folks who look sick. So people who are really not feeling well, where normally you'd be maybe asking them if they need to lie down or take care of themselves, and they have some fever, cough, shortness of breath. So for those folks, you need to not only give them a mask, but you need to send them out. So you're not going to keep them and drop in or shelter or let them lie down someplace there. You're going to send them out to clinic right away to get evaluated. And again, hopefully your county is setting aside places for unstably housed and homeless folks to be while they're sick so that they can be monitored, but they should not be with your general shelter population. They should not be with your folks who aren't that sick. and they should go straight to clinic. And then folks who are very sick are folks who are having a lot of shortness of breath. They're having trouble talking. They're having trouble with regular activities. They might be feeling some pressure or pain in their chest. This isn't really so much looking for a heart attack, not that kind of chest pain, but people with COVID-19 without having any cardiac problems, even if they're young, can have pain in their chest, pressure in their chest from the illness in their lungs. Also, folks who suddenly seem confused, they're not being themselves. Certainly someone with blue lips is someone who's really sick. Anyway, any of those folks, whether they have an underlying condition or not, you need to call 911 and send them to an emergency room. They should not be staying with your general shelter or drop-in center. So this is an overview of what you want to do with folks who are sick. If people are sick but not very sick, so really just basically, I feel fine, it's okay, they look okay, but they do have some fever or cough or minor shortness of breath, but they have no underlying condition, then they can have a mask and be separated. Everybody else, whether they are not that sick and they have an underlying condition, or they are feeling moderately sick, those folks need to go to clinic, and everyone else who seems quite sick needs to go to the emergency room. So the only people who should stay in shelter are folks who are sick but not very sick, really basically feel okay. They should have a mask, they should be separated, they should go in their own room or a large ventilated room and be encouraged to be staying 6 feet apart. Again, we're working on adapting a screening tool that has been developed in Atlanta to help you with screening and triage, and we're going to be sharing that very soon. So our next video is going to be on personal protective equipment, understanding them, understanding what they can do and what they can't do, and how you should use them. So please respond to the survey that we'll be sending out. We would like to know if you have additional questions and try to answer them as best we can here at the School of Public Health at Berkeley. Thank you for all you do. Be safe and be well.